There is a lot of research that demonstrates the connection between childhood abuse and drug addiction, especially for women, and sexual abuse. And it is important for leaders like us in the field of human and social services to learn what the patterns are in our society relating to this topic, but also what approaches we can take towards prevention. So, as you can see in this poster, just to give a few statistics, 75% of women and men in addiction treatment recount previous experiences of trauma and abuse, while also 55% of women who experience sexual abuse in their lifetime have a drug or alcohol addiction. So, one of the main factors that contributes to the prevalence of drug addiction in women with trauma and past experiences of sexual abuse is poverty. Those caught in a cycle of poverty are more likely to abuse or experience abuse within their household. In these same households, some substance misuse is very prevalent because these environments are usually high stress. Additionally, race can be another factor that plays a role here. Minorities are at a higher risk of being marginalized, which tends to result in more stress and adverse experiences. This can then lead to turning to substances like drugs and alcohol to cope with the stress. Not to mention that when we are talking about women with past trauma from sexual abuse, there's a lot of stigma and shame that can be associated with that. This alone can cause high levels of stress, confusion, depression, and anxiety, which can increase the likelihood of using substances to either self-medicate or cope with the pain and trauma. So one of the best and evidence-based approaches to addressing this problem is trauma-informed approach. There is a lack of services for people with drug addictions who also have trauma that do a good, balanced job of addressing the trauma first and foremost. Instead, a lot of programs in practice simply try to win people off their drug, but they don't realize that the problem is deeper than the drug and goes far into their past. Additionally, it is important to consider gender-responsive treatment, specifically for women with drug addictions and trauma from sexual abuse, because this type of treatment would factor in things like the possibility of re-traumatization or certain triggers or cues that could result in relapse. And lastly, the best way to be a part of the solution as leaders in this field is to partake in early prevention and intervention within families and communities. So based on the relationship between drug misuse and women who have been sexually abused, there's a lot that could possibly be avoided by attacking the root of the issues instead of putting more and more people into the prison system or into programs that don't actually acknowledge the existence of trauma from women's pasts and in people who just need professional help and the right resources to recover and heal correctly. So, all in all, context is a very crucial thing to consider for treatment approaches and studying certain populations like women who have past trauma from sexual abuse and are struggling with drug addiction.